Can you start our video, please?
This meeting
Great,
is
thank
being
you.
recorded.
Excellent. Good afternoon, everyone. My name is Dan Paternak. I'm the chair of the Aging Committee of Bronx Community Board number 8. We have our committee. Looks like we have. I'm just looking to see if we have a quorum or not today. I think we do. Let me see, or close to it. Yep, no, we do. Well, I'm going to take a roll call first. Let me just start that way. And then we'll introduce some of our guests here today. My name is Dan Paternak. Sylvia.
Here.
Okay. Margaret Della. Okay, Margaret's not here yet. Lisa Daub.
Here.
Okay. Margaret Donato.
Here.
Okay. Rita Lowe. Not here. Karen Pesh. Okay, and I see that we do have some members here from our local providers. Let's see. Sharon, do you want to introduce yourself?
Hi, I'm Sharon. I'm the director of Why.
Hey, Sharon, you're just breaking up a little bit. Can you do that one more time?
Hi, I'm Asha, director of the Center DOY. Can you hear me?
The what center? I didn't hear her.
It's the Riverdale Y. Sharon,
Thank you.
your internet connection is going kabooey, so.
I don't know what to do again, do anything about it. Lisa can translate.
I see Lee is here. Lee, do you want to introduce yourself?
Hi, I'm Lee Chung. I'm a resident of Spuyten Duyvil, and I'm also the chair of the Riverdale Senior Services Social Action Committee.
Wonderful. I was wondering how to pronounce that neighborhood, so thank you.
Spuyten,
Okay.
spit at the devil.
Okay.
That's what it
Great.
translates to.
Oh, okay.
Okay, and I see we do have some guests here from HRA.
Yes.
Would you, and whoever would like to go first, just introduce yourself?
Dawn, you can introduce yourself.
Good morning. My name is Dawn Shuck, and I'm the outreach coordinator for OCHIA, the Office for Citywide Health Insurance Access here at DSS/HRA.
Great,
And I've
welcome,
been here
Dawn.
for about a year.
Great.
Hello, good afternoon, everyone. My name is Audrey Jope, and I am the managing executive director for the office in which Dawn and I work.
Great, welcome.
Thank you for
Julie,
having
I
us.
saw that you, well, thank you. Thank you for attending. Julie, I see you're here. If you can introduce yourself.
Yes, hi, I'm Julie Dalton, the Executive Director of RSS, Riverdale Senior Services.
Welcome, Julie. I think the only person we haven't introduced is David Gelman. David, would you like to introduce yourself?
Hi, sorry. Hi. Community Board 8 member and chair Budget Committee.
Great. Welcome, David. And Rita, I see Rita is joining us. Rita, are
Hi.
you there?
Is this the aging committee?
Yeah. Yes, it is.
Okay, I made it.
Yeah.
Had trouble signing in. Where's my picture?
It's upside down, but not on. It's kind of actually interesting. You've got a camera upside. Yeah, I don't know.
I don't have a picture.
You have to turn the camera on. It's off.
How do I turn that on? I'm sorry.
It should say on the bottom
Video.
left. On the bottom
see
left,
you.
it'll say stop video and right
Stop
next to
video?
mute.
Do I stop video?
No.
If you hit that button, it should say start video.
Oh, start. Okay.
There you go. And
Where's my
then,
picture?
are you signed into Zoom?
I went through Zoom. Yeah.
Are you signed in? Sometimes when you don't sign in, your picture does not appear.
No, I did sign in. That's how I got on and got my name up there, but
hmm
I hate when this stuff
Okay.
happens.
Okay, well, keep working on it. We're going to start moving forward.
Okay.
I would like to welcome, once again, from HRA, the Human Resources Administration of the City of New York, are here to present some important topics, of which I think is great information for our committee and our committee members and our community to know. Dawn, Audrey, I'm not sure how you guys want to coordinate the presentation, but
Yes.
the floor is yours.
Thank you. And I'm going to share my screen. Can everyone see it?
Yes.
Yeah.
Okay, wonderful.
Yes.
So we are here to talk to you today about key health insurance options for New Yorkers who are living with a disability, visual impairment, or is an older adult. For this purpose is a person 65 and older. So let's see. Let me go here. Hopefully. Okay, let's switch this. Okay, so this is what we're going to talk about today, the mission of our agency, of our office, what are the available options, Medicaid, emergency Medicaid, Medicaid excess income, Medicaid buy-in for working people with disabilities, Medicare and Medicare savings programs, getting or maintaining coverage, how we can connect people to coverage and care, and references and resources. And we will send the presentation to Tanya as well once we're done.
That's great. We'll attach it to our minutes for this month, so that way everybody can see it.
Wonderful. So our agency, HRA, Department of Social Services, is dedicated to fighting poverty and income inequality by providing New Yorkers in need with essential benefits. We help over 3 million New Yorkers with a variety of services to meet their social service and economic needs. HRA is committed to serving all New Yorkers, regardless of their race, religion, sexual orientation, gender identity, language proficiency, or disability status. In our office, the Office of Citywide Health Insurance Access has been in existence for over 2 decades, and we work to connect New York City residents and small business owners to coverage and care. And we do that in several different ways. One, we have a website called New York City Health Insurance Link that has a host of information. Everything you ever wanted to know about health insurance is on there. We work with a broad network of partners, including community boards, so we're happy to be able to present to you today. And outreach, education, and training efforts on public and private health insurance help us get information out into our communities of New York City. The Facilitated Enrollment Program for the Age, Blind, and Disabled, which is a technical name giving to the program, which I will talk about, is the newest body of work to our portfolio. We've been doing that work for about 8 years to connect folks free enrollment assistance for Medicaid and help to pay for Medicare. All of the work that we do is supported by policy research and analysis. So these are some of the core benefits that the agency offers. I won't list them all. I'm sure you're aware of many. Cash assistance, SNAP, homeless prevention and services. We also have immigrant services and language access, IDNYC, domestic violence services, and home energy assistance program to help people pay for the cost of energy in their home. So let's move this. Who are the people who are age visually impaired or living with a disability? Again, people 65 of age or older. Someone who is certified blind by the New York State Commission for the Blind. And a person with a disability is certified disabled by our agency, the Social Security Administration, or the state Medicaid disability team. And these are the health insurance options that are available. Medicaid, including institutional care in a nursing home, Medicaid buy-in for working people with disabilities, Medicaid excess income program, Medicare, and the Medicare savings programs. Who qualifies? Well, folks qualify if they're a New York State resident and can prove their identity. They have limited income and resources, and of course, appropriate citizenship and immigration status. And because of the public health crisis, there has been a relaxing of certain qualifications, including residency, identity, income, and resources during the pandemic, people can attest to that. However, they still must provide proof of citizenship and immigration status. It's what I just said. The other qualification for Medicare is, for Medicaid, is that folks must apply for Medicare. But because of the public health crisis, Medicare eligible consumers do not need to provide proof of their Medicare application, nor do they need to submit proof of applying for Medicare as a condition of Medicaid eligibility. This requirement is waived until further notice from the federal government. So how does one prove their residency? There's no time requirement to be a resident of New York. You would just have to provide a rent receipt, lease, or post-dated marked mail, non-window envelope, and bring it back to the person helping you enroll. That would be a proof of residency. For identity, the things listed here, including a US passport or a passport from a foreign country, a legal permanent resident card, also known as a green card. Citizenship and immigration status. So qualified immigrants and persons lawfully residing in New York, regardless of length of time in the country, are eligible for Medicaid. This category, it tends to be unfamiliar with folks. It's called PRUCAL, permanently residing under the color of law. And this is immigrants who are eligible because they are in the US with the knowledge and permission of the United States Citizenship and Immigration Services, and includes immigrants, among others, who are waiting for their interview with USCIS to become lawful permanent residents. So this is not federal law, this is New York State law. And for example, if I come from another country and I come to the US and I fall in love with Dan and we get married, and then we apply for me to stay permanently with USCIS, the receipt we receive can be used to apply for Medicaid as long as we are otherwise eligible. Who is not a qualified immigrant? Well, that includes a person with a short-term visa, for example, tourists, unless they have filed to stay on a permanent basis, and undocumented immigrants. Here you have the income eligibility for Medicaid. A single person can get Medicaid if their income is below $934 a month, and their resources is what is listed here. It is important to note that the governor's budget, or the enacted state budget, included an increase of the income eligibility level for Medicaid. Next year, it will go up to a little bit more than $1,500 a month. And the resource level will increase to over $26,000. There is also emergency Medicaid, officially known as Medicaid for the treatment of emergency medical condition. And this is the ability of someone who's undocumented, because a person who's documented can get full Medicaid, but this is a resource for a person who's here in the country or in the state, I should say, to be able to get an emergency condition treated. So for example, if I have a heart attack and I'm undocumented, I can go to the hospital. I can either have my Medicaid with me, that is, you can apply before you have the emergency. The coverage is only good for when you have an emergency, so it would only get turned on if a doctor declares you to have an emergency. And as long as you're otherwise eligible, Medicaid will pay for the coverage of that heart attack. However, no other treatment for any other non-emergency condition would be able to be covered. Most people who are 65 or older who have a disability, they would need to complete an application, and they could get help to enroll by calling 347-396-4705, which is a program I will talk about later that provides free help to apply for Medicaid. If you have that emergency, you have to sign up within 3 months of having the emergency, because Medicaid goes back 3 months to pay for medical bills. And this is just listing what is the definition of emergency medical condition. It's something that places a person's health in serious jeopardy, or serious impairment or bodily function, or serious dysfunction of any bodily organ or part. The most important thing is only a provider can deem a condition an emergency. Medicaid Excess Income Program is a program that helps the folks listed here under age 21, 65 or older, certified blind or disabled, or pregnant or parent of a child under 21 get access to Medicaid if their income is above the Medicaid level. So if you recall on the previous slide, I said that Medicaid income for a single person was $934. So if your income, for example, is $1,000, you can give Medicaid, there's a disregard of $20, which brings it up to $954. You could give Medicaid $46 a month for the months in which you need Medicaid, that is, in which you have a medical appointment, or you can pay Medicaid 6 months, 46 times 6, which is $272. You can pay Medicaid that amount, and in addition to outpatient services, you would have inpatient coverage, that is hospital coverage. You can also provide bills that are equal to or above that $46 a month. So Medicaid excess income is a way for people to access Medicaid whose income is above the Medicaid level. Medicaid buy-in for working people with disabilities. This is a very robust but underutilized program. It is for people between the ages of 16 to 64, employed and receiving wages or salary. It doesn't matter how much the person is getting paid. They must be certified disabled by the Social Security Administration, HRA, or the state, and they can have income up to $2,832 a month, and up to $20,000 of resources. And you would notice that this is a more robust, generous income program than Medicaid alone. Next to last, I'm going to talk about Medicare. Medicare is a federal program available to people 65 and older, some people with disabilities, and people with end-stage renal disease. There is 2 parts, Original Medicare or Medicare Advantage Plan. Original Medicare includes Part A, Part B, and Part D, hospital insurance Part A, medical insurance Part B, and prescription drug coverage Part D. Medicare Advantage plans are available. They are private plans through health insurance plans that incorporate Part A and Part B and Part D, and they often offer extras like vision and dental. Who is eligible for Medicare? You must be a U.S. citizen or legal permanent resident living continuously in the U.S. for 5 years. A person must be, again, 65 and older, or receiving Social Security disability income for 24 months. The exception is people with Lou Gehrig's disease or end-stage renal disease do not have to meet that requirement. There is Part A in Original Medicare that is free to folks who have done their 10 years of work or have 40 working quarters of work history. And that's important that one checks their Social Security records. It used to be that the Social Security Administration would send your working history every year. Now you must sign on to ssa.gov and check your working history to make sure you're being credited for each year that you work, as well as your name and any other identifying information is correct, because one does not want to wait until it's time to retire to ensure that their Social Security work history has been documented properly. The income, however, if you don't work the 10 years of work, is if you, let's say you have 34 quarters of work, you would be, you would pay $274 a month. However, if you have 28 quarters of work, the cost of Medicare Part A would be almost $500 a month, $499. This is the cost someone will pay for Medicare Part B. This cost does not have to do with work history. This is just the cost of Medicare Part B. So for example, if I retired this year, my earnings are based on my 2020 income earned. And so for example, if my income in 2020 was up to $91,000, I would pay $170 a month for Medicare Part B. And as you see, as my income goes up, so does the monthly Part B monthly premium. It is important to enroll in Medicare on time. That is, you enroll 3 months before your 65th birthday, the month of your 65th birthday, or up to 3 months after your 65th birthday. If one does not enroll, there's a 10% penalty that you will receive that's permanent for your Part B premium. And that's 10% each year that you do not enroll. To help pay for the cost of Medicare, there are Medicare saving programs, and they are available through Medicaid. And depending on your income, it may also pay for other Medicare cost sharing expenses. There are 3 programs that I will talk about: Quimby, SLIMBY, and QI1. Quimby is a qualified Medicare beneficiary program, and the people's income must be at or below 100% of the federal poverty level. And that is $1,074 for a person in a family of 1, or $1,452 for a family of 2. SLIMBY, Specified Low Income Medicare Beneficiary Program, is available to folks with an income up to $1,288, a family of 2, $1,742. And QI1 is available up to 135% of the federal poverty level for a single person. That is $1,449 a month, or $1,960 for a couple. The most important thing to understand about the programs are that with Quimby and SLIMBY, you can have Medicaid, and with QI1, you must choose between a Medicaid and QI1. There's no resource test if consumers only want the Medicare Savings Program. If they want Medicaid too, they will have to pass the resource test that I mentioned previously. The Quimby program pays for many things. It's a really robust program. It helps pay for your monthly premium, including penalties for late enrollment, Part B deductible and coinsurance, Part A premium for people who do not have enough work history, Part A hospital deductible and daily coinsurance when hospital stay exceeds 60 days, skilled nursing, as well as HMO co-payments and coinsurance. So it's a very robust program. This is an example of applying for the program and Medicaid. So Carmen applies for Medicaid. She is in receipt of Medicare and Social Security disability insurance. Her gross monthly income is $850. The allowance I mentioned before deducts from her income, and she has a net monthly available income of $830. Because the Medicaid income eligibility level is $934 for a single individual, Carmen is fully Medicaid eligible. she can have both the Medicaid program as well as Quimby, and she will be enrolled in Medicaid and Quimby. So she will get that extra help to pay for Medicare costs. The specified low income Medicare beneficiary program covers the Part B premium. And the key thing about it is it goes back 3 months retroactively to pay medical bills. So for example, if I apply, this is May, if I apply for this program this month and I have medical bills from March, Medicaid will go back, and Medicaid as well as SLIMB will go back and pay my medical bills as long as I was eligible for Medicaid in March. So here is an example of how SLIMB works. Niles applies for Medicaid. He is in receipt of Medicare and Social Security disability insurance income. His gross monthly income is $1,300. The disallowance is $20. His net monthly income is $1,280, which is above the Medicaid level of $934. Niles has two choices. His income is $346 above the Medicaid level. He can pay HRA 346 or provide medical bills. If he wants Medicaid. He also must meet the resource test. Niles is Medicaid eligible with an excess and Medicare savings program, SLIMB. Niles has a choice of enrolling in SLIMB and Medicaid with a surplus. If he decides he wants to enroll in SLIMB, he must meet at least 1 month's surplus to be enrolled. He can have both Medicaid and SLIMB. The last program is the qualified individual. And this, as I mentioned earlier, program is only available, this program or Medicaid, a person cannot have both. The program covers the Part B premium, and you can receive benefits of up to 3 months retroactively. So again, if you have medical bills that, or for instance, if you have a medical bill that that you need to be paid for, QI1 can go back and pay up to 3 months retroactively for that bill. This is an example. Lorna applies for Medicaid. She is in receipt of Medicare and Social Security disability insurance. Lorna's gross monthly income is $1,450. Her net monthly income is $1,430. Her income is above the Medicaid level of, it is $496 above the level. Since she cannot have both programs, she must choose which program that she wants. If she chooses Medicaid, she will pay Medicaid $496 per month, or for the month she needs Medicaid. She must also meet the Medicaid resource test. If she does not want Medicaid, she can just have the QI1 program to get help to pay for, or to get her Medicare Part B premium paid for. So I have mentioned previously about some new expansions, Medicaid expansions in the New York State enacted budget, and this is a listing of those expansions. So the income level for Medicaid, income eligibility level, is raised to 138% of the federal poverty level, and that's about $1,500 for individual. It increases the Medicaid resource limit for people 65 and over and people with disabilities. It raises the eligibility level of the Medicare savings program for 100% to 138% for the Quimby program, and 186% to the last program I mentioned, QI1, Qualified Individual 1. And it will eliminate the SLIMB program because everyone will now get Quimby. Also effective March 1st of next year, undocumented immigrants will be eligible for Medicaid. That is undocumented immigrants age 65 or over. Medicare Advantage plans that I mentioned incorporated both all three parts, Part A, Part B, and Part D, is administered through private companies. And so a person must have Medicare Part A and Part B to participate in the plan, and they must live in the health plan's service area, and they cannot have end-stage renal disease. So it's very important to get coverage, but it's also important to maintain coverage. And with Medicaid, one must renew annually. Because of the public health crisis, renewal has been automatic, meaning that Medicaid program has not been disenrolling anyone who did not turn in their renewal program. A person 65 and older receives a renewal information from HRA, and a person under 65, that is one who is living with a disability, who can either enroll through HRA or the New York State of Health Marketplace, receives their renewal program through the New York State of Health. The last item that I will mention is our New York City facilitated enrollment program for people 65 and older living with a disability and visual impairment. This program can be reached by calling 347-396-4705, and it helps people enroll in Medicaid and Medicare Savings Program free of charge. Once we are out of the public health emergency, enrollment will continue, or I should say resume, at senior centers and health centers in the Bronx, Brooklyn, Manhattan, and Queens. But right now, enrollment is being done telephonically until the crisis is over. And it's a very helpful program. The enroller helps the person enroll electronically. The application is sent electronically to HRA, and that can speed up the enrollment process. Access HRA is a public-facing website for clients who already have services through HRA, or someone who's looking to apply for certain services, including SNAP and cash assistance, and also someone looking to have made available to them one-time emergency assistance. You can apply through Access HRA. There's a program that you may not be aware called Fair Fares that is available for people under 65 who have low income. For a single person whose income is up to $1,074 a month, they can get reduced fare Metro cards. The Access HRA app also allows people to upload documents, read notices from HRA, as well as view their case details. And the app can be downloaded on both Android and Apple platforms. Here's some references and resources that are available for consumers, as well as people who help people 65 and older. And what key one is community health advocates that can provide free, confidential individual counseling and can help people access services that they may have been denied by an insurance company. And that is the presentation. Do you have any questions that you would like me to answer? I know it's a lot of information.
Yeah.
That's why the facilitated enrollment program is available to help consumers as well as you all answer any questions that you may have. It should be easier for folks to enroll, but it can be a little challenging for a person 65 and over to enroll, and free help is available through the facilitated enrollment program.
Gotcha. Okay, and any questions out there? Yeah, pretty thorough presentation there. So are you finding within communities, is there a challenge getting this information out to folks
Well,
or
because of the
individuals not knowing it's there? Yeah.
because of the pandemic, it's become very challenging. Prior to the pandemic, though, people 65 and over, if they know, they know, but there are certain communities, particularly immigrant communities, that may not know that this help is available, may not know about Medicaid, may not understand how to enroll. So yes, for certain communities, it is really challenging to get the information out and let people know that the benefit and actually the free enrollment help is available, that they don't have to go at it by themselves.
Mhm. One of the things I noted is that for an individual who is undocumented, they could still apply before an emergency occurred,
Correct.
meaning they can go in. Well, go ahead. Yeah.
Yeah, no, go ahead. Say it. Because
Yeah, it just seemed interesting. And just to kind of verify this, essentially an undocumented individual can apply to Medicaid, essentially get the paperwork done, rolling. I'm not sure, would there be, I'm guessing there's some sort of card or something
they
that
get the
they walk into
same-
a hospital if something
Yes.
happened.
they get the same Medicaid card. And if they have it before, as I said, it wouldn't get activated until the doctor declares an emergency. That is, they, have a heart attack or they get hit by a bus, something that is causing them to be threatening their lives, then it would be turned on. The hospital would get it activated with Medicaid. Now, if they didn't have it before they had an emergency, the hospital would help them apply for it.
Mhm. Gotcha. Okay. Yeah. No.
Yes,
Go ahead,
Lisa.
Lisa.
Sorry, did I catch that in 2023, undocumented individuals will be eligible for regular Medicaid? Did I say
So,
that?
yes,
Okay.
you heard it correctly. Let me put it back up. The changes that are coming in 2023. Can you see it?
Right, okay.
Yes, so undocumented immigrants aged 65 and over will be eligible for Medicaid. So they will be required to join a mainstream Medicaid managed care program, but yes, they will be eligible for regular Medicaid beginning. So these folks 65 and over will no longer have to just have emergency Medicaid.
Okay.
Thank you.
Any other questions from committee members? Okay.
No.
Well, thank you, Audrey. I mean, again,
Thank
very
you.
thorough presentation. It's good to know this. I didn't know most of this information presented. So it's very
Yes.
helpful.
Yes, and
Thank you.
we thank you for the opportunity. And again, what applies to all of us is to ensure that our Social Security records are correct so that we don't wait till retirement time to, oh no, things need to be changed. So,
Yeah.
right?
Yeah.
So thank you for your time and attention.
Thank
I
you.
wish you enjoy the weather and have
Thank
a
you.
wonderful, wonderful
Yes.
summer. Okay.
Thank you. You too. Thank you,
Thank
Audrey.
you
Thank
for
you, Don. We
inviting us.
appreciate you coming out. Thank you.
Okay.
Thank
Have
you.
a great day.
Okay, so I hope that was, I mean, there's a lot of information for me to take in and yeah, very helpful to know. Okay, so I'm going to move on with the next part of our agenda. There was no meeting last month, so we didn't get to finalize our budget requests. So I'm going to pull those up for the committee. I did note, in February, I was working with an older form. I guess I think it was the year before that I had. So let me just share screen. Where are we? Here we go. Share. Okay, so let me just kind of correct this. And I'm going to go through some of the older requests that we had from last year. And this is what had gone on the final budget requests from the Aging Committee. when the board finally voted in October of this year. So the first request that we had was for senior center funding. Increased dedicated funding to ensure qualified staff, access to mental health services, funding for licensed social worker, technology infrastructure internally, technology support externally, increase outreach to lessen isolation and potential abuse, provide food security, and meet all service delivery funding requirements. The gist of it is senior center funding with all of the other items listed kind of coming underneath. And this was number one priority for the aging committee that came out of last year's budget requests. The number two priority, senior center transportation, pardon, dedicated permanent transportation service funding and senior center contracts. Walkability in many sections of our community is difficult. Steep hills, step streets, and long walks. Regular bus service provides limited north-south routes and even fewer east-west routes. Additionally, transportation services can provide vital food access for older adults. So that was the number two priority from last year. The third priority, affordable housing serving older district residents. To reduce homelessness and allow older residents with a low, moderate income to continue to age in their familiar communities. Increase funding for housing subsidies for current residents to avail themselves of neighborhood preferences in new and existing affordable senior housing buildings to prevent evictions from current units and provide support for other programs that allow seniors to age independently and in place. Number four last year, DIFTA, increase to funding in dementia care. Non-subsidized social adult day programs have closed, leaving only one nonprofit social adult daycare in CB8. Expand tuition assistance for nonprofit programs to allow more eligible seniors to afford SADC and fund outreach programs to educate family caregivers on dementia, safety issues, and caregiver opportunities. Aging committee, the number five priority from last year, which went in, was increased funding to inspect and maintain pavement at crosswalks throughout the district to mitigate falls that often lead to health decline and death, refresh crosswalk line striping to increase driver and pedestrian visibility, lengthen pedestrian walk signals, and add audible crossing signals near large senior populations and shopping areas. I will note the audible crossing signals have been a big issue in this community for many years. DOT has been very sparing within our community about the pedestrian accessory signals. We did get a couple in North Riverdale in the last year because there was an individual, there was a blind individual and he was really advocating, we were advocating, and there were a couple in North Riverdale that were put in by Marshall and such. But again, you know, there's very few in this community board considering the amount of intersections
Thank
we
you
have.
for that.
Oh,
Thank
you're
you
welcome.
for that,
Rita.
Dan.
Aging committee. So these are this is not on last year. 5 expense budget items went on last year. These remaining 3 that we see here are just issues that came up at the last meeting. And the accessoride has been here for years also. Food programs, increased need for congregate food programs in general, plus meals for individuals who are temporarily homebound. Now we have the senior center part of it. I don't know if we want to make a statement regarding just food programs in general. So that's why that's there. MTA accessoride has always been an issue, continues to be an issue. In addition to senior centers needing their own transportation, you know, accessoride has produced many challenges for older adults within our community and those with disabilities. So we have increased service for accessoride for older adults with disabilities within CB8 because of its particularly hilly topography. And then one issue that continues to come up is internet access for older adults. So while there's the technology aspect of getting seniors trained and getting tablets and such into their hands, there's also just the very general problem of older adults getting internet access for those who can't afford it. You know, it is still fairly pricey, you know, especially if you're on a fixed income to afford internet each month. So these are some of the items. We're open to more suggestions. We're open to discussion right now to take a final vote and submit these into the board. Again, we didn't meet last month, so we didn't take a vote at that point. So I open up the discussion. Does anybody have any feelings on where we are with these items? Do we want to repeat where we were last year, change anything, move the order? It's all open. Lee, I see your hand up. Are you on mute, Lee? Oh. Is that me or?
No, I can't hear you, Lee.
I can't hear you, Lee.
Mic might be off. Oh, now? No,
No, still can't hear you.
can't hear you, Lee.
Do you have an earpiece in, Lee? There's something with your mic that it's not working for whatever reason. Lee?
Want to press F1 or F2 on your, if you're on your laptop or?
Can you hear me now?
Now we can.
Got it.
Yep.
All right, I don't know what I did, but I did something. I'm one of the computer illiterates. I just wanted to make a clarification for number 3.
Yes.
Where you mentioned HPD and then you mentioned seniors aging in place. They're called NORCs, and I think it should be mentioned that they're called NORCs, natural occurring communities,
So,
retirement communities, and they're not really through HPD, they're through DFTA, and it's a linkage between a development that has an aging population and a senior center, and the example is Amalgamated. That's a NORC.
so Lee, let me, if we can just go back from the very beginning, you were saying which part of this is incorrect on number 3?
HPD, if you're talking about aging in place, to avail them of, I think you mentioned aging in place, I thought.
We
prevent
did.
From current units. Well, maybe it was mixing 2 real issues. One is creating affordable senior housing, which is what HPD does with HUD.
Yes.
And the other one is aging in place so that seniors can stay in where, they live currently and age in place. And that's called a natural occurring retirement community, NORCs. And
So correct me if I'm
Amalgamated-
wrong, if we can, I think when folks are talking about aging in place, I think we're talking about everywhere. I don't think it's just particularly a NORC, but if somebody lives, I don't know, in any part of our CB, let's say they live in, I don't know, North Riverdale, and we're looking to keep our seniors aging in their current apartments. There are certain programs out there right now that are subsidized to keep them in those units aging in place.
So you're
I
not
think that's a little different than a
about
NORC.
buildings where the predominant population has become seniors.
I think we're talking about the entire community board. At least that's the way I read it.
No. Oh, all right. No, because there are some buildings, like for instance, my building, RPT.
Mhm.
We have a large population of seniors. And
Mhm.
eventually a lot of these people who are now not seniors, if they agree to, want to stay here, will be seniors. And at some time they might want to all stay here, and we should create a NORC for them. So I'm thinking that's what happened at Amalgamated. I know the ones in Manhattan, there are a lot of them in Manhattan, where they link up with a nonprofit senior center. And the senior center provides medical as well as social and food. And it's done in the development itself, the apartment buildings.
Mhm.
I don't know
Yeah,
if you
there's
want
quite
to
a
put.
few.
So here's a thought. So in order to receive city or state funding for a NORC, you have to have a certain percentage of the people in the building have to be seniors.
Correct.
And they require there has to be a community assessment that determines whether you can be a NORC or not. And in my mind, like when the last RFP came up, so the thinking was, well, is Skyview a NORC? Are these buildings down in Spud and Duyvil a NORC? And how do you do that assessment and figure out whether, because there's something called a neighborhood NORC, which is just a neighborhood where there's, sorry about the dog barking. But anyway, there's, so like you can have a neighborhood NORC. It doesn't necessarily have to be in your, in Am Park or in a housing project. And the question is there funding to do that community assessment, or how do you do that? How do you do that community assessment so that the next go around you can propose that we want funding for Nork for some of these buildings.
Maybe your next presentation, you might want to have Live on New York do something, have a presentation about that, because they are involved with Norks. I found that out last Thursday.
Well,
My understanding, and before I joined the board, that there was a group who tried to put a community Nork together.
Mm.
I think, and Dan, maybe you remember or not, I think there was a lot of opposition
Mm.
because it might
Mm.
sort of turn people off to coming into the community, younger
folks.
families. So, I mean, it's certainly something that can be looked at. I think RSS is so close to Spuyten Duyvil that I'm sure it serves a lot of the individuals. I don't know if Julie, you're there, but
Yes.
I think, anything around the Century Building, which is pretty close. I think RSS does serve them, but there could very well be other benefits to a NORC. I don't know.
Mhm.
Something to explore.
I think it's certainly something to explore. I'm not an expert on housing, but I know that for DIFTA-funded NORC programs, correct me, Sharon, if I'm wrong, I believe there also had to be a state match. The NORCs don't exist solely on city funding. There needs
Right.
to be a match from the state. Before my tenure at RSS, RSS did apply to become what they call a neighborhood NORC in the Knowles Crescent area. Again, this was before me, but it wasn't accepted, and again, I think part of it was the difficulty in raising, the funding. It's not just in vertical high-rise buildings,
Right.
but I think NORCs are really challenged in the city because of the need for that state match. But yes, the basic idea is that in a community, whether it's a high-rise building, that has naturally become mostly older adults, and the nonprofit sponsor brings services on site to them. So, it's definitely an interesting model. I think in terms of the other paragraph that people were talking about, just housing, I think the intent of that language might have been to increase more availability of funding for subsidized low-income housing in the community. And yes, Live On has a whole housing division. They would be a good speaker. I mean, again, I don't really know housing that well. In my spare time, I'd like to learn more.
Gotcha. Okay. I think for now, we're not getting, unless Sharon, there's something that you're asking us for, any particular funding request for NORC, the one NORC that we do have. Meaning we have,
No, we don't.
you're not seeking additional funding at this time
No, we
for the NORC.
have the funding you need. There is a match, and the AMPOC provides a match, and that's state funding. And I assume the Y may be applying for city funding to supplement it at some time. But I don't think there's a need necessarily for any more. Where I see the needs in our community, and also in the North community and in the Riverdale Y is food. Food access has become, because the price of food has gone up so dramatically. More people need access, whether it's to senior center food or just to food pantries. And I mean, we've have a food truck come once a month, and it basically sells out with seniors lining up to get food, just because the prices have gone up so dramatically. And the pricing also has, although we just RFP'd in the senior center, nobody would have anticipated that the cost of food would go up 15% since the RFP was done last year. And there needs to be provisions to cover that in the DIFTA contracts.
Gotcha. Do you want to change anything in here when we have, as far as senior center funding?
Well, I think you have, if you scroll down, you had food, you had some notes about food.
So we had a it was something that we have here. It's a newer request, increased need for congregate food programs plus meals for individuals temporarily homebound.
I think you might want to just, tweak that a little bit to address the need of food insecurity and how much it has become magnified in our community, and not only increased funding for congregate meal programs, but increased funding for food pantries,
Right.
so that an older individual has both options. If they can, they come to the center. If not, they go, on Thursday to the local food pantry, and that food pantry has enough resources to have the food, have a place to store it, and have the staff to distribute it.
So food insecurity has become increased within our community. There's an increased need for, I'm sorry, what was the other, in addition to the congregate food programs? What else should be placed in there?
I would say, funding for, additional food pantries. I mean, there are a few, but I know, KHCC has a food pantry, St. Stephen's has a food pantry, but
Yep.
most of them are like 1 or 2 days, the Y, of course, 1 or 2 days a week,
Mhm.
there's always, I think as Sharon is saying, there's always a need for more.
Okay. So I'm going to put that, and I don't know if the committee wants to bump up food programs a little bit higher up in our list or not, but I'm certainly open to that suggestion. I think we're hearing a lot about that lately in food insecurity.
Yeah, I would definitely move it up.
Yeah.
But let's see what gets pushed down.
I mean, quite frankly, I think food, just to make a statement about food insecurity, which I think we're seeing across the entire city of New York, I would probably move that to number 2 or number 3,
Mhm.
just under, senior center funding. Oh, Margaret, I see your hand is up. You could just kind of join in, we're a small committee.
Sure. I'm on the train, so I'm sort of
Yep.
in and out. But one thing I wanted to add to this list that I thought was already being addressed, but the bus station on the east side of 231st and Broadway. I don't understand why we don't have the time clocks there, how much time until the next several buses. There's no seating. I know they, everyone there waits in a long line too, but I thought it was addressed by TNT, but I think it's something we should put there.
On the aging committee?
Absolutely. I mean, how many little ladies with their carts are waiting at that bus stop, and people just stand there and wait and wait and wait. And I don't understand why it doesn't look the same as the West Side. We have a bus stop. People can stand under there if it's raining.
So are we talking about
Perhaps
the bus
it's
shelter, or are we talking about the countdown clocks?
both?
And you're on the east side, we're talking in front of the new Chipotle, right? Margaret?
Yeah.
The just location, I wanted to confirm, we're talking right in front of the new Chipotle on 231st, right?
Correct.
Okay, so I remember years back, we put in a request for chairs, and we had done that with the bid. The Kingsbridge bid had put in that request. I don't think they ever came about. I don't know what happened with that request, but that went into DOT for that purpose. So look, for purposes of our budget request, I'm certainly, I wouldn't object to putting in for the countdown clock. Certainly, I don't know if there's issues with a bus shelter there or not, meaning space. And again, I say that just because our simple request for the chairs still hasn't been, I don't even know if we responded to or not. But any other committee members have thoughts on the topic?
And can you put in something in general about, or as opposed to a specific location, the need for, more countdown clocks and bus shelters and chairs at every, at every bus stop, or is that too vague?
I think that's
Well,
too big. I want to be specific.
So let me just kind of think for a moment here. Are we, and I ask it, and I'm just gonna put it out there, are we stepping on TNT's chairs if they haven't spoken about this yet? About the bus shelter? Like is this something that instead of doing it as budget request, do we want to refer to the traffic committee from the aging committee?
Yeah, I mean, because it did come up in TNT and there is a request.
So
out. Yeah.
I know when I was chair of TNT, we had a request for the benches, without a doubt. I never put in a request for a countdown clock at that location. I know that. I think certainly seniors, and there's a lot of folks who sit on that east side. And I know that on 231st Street at 10 o'clock at night, and there's still folks standing outside there waiting for buses. So I guess the question for committee members is, do we want to refer the bus shelter issue to TNT before putting it on a budget request?
I mean, we have housing, we have food, we have every other request under the sun. So.
Yeah, no. So the food part, the housing part, that all, yeah. I don't necessarily know that there's going to be an issue. And again, I don't look, we'll put it down here. And if we get yelled at, we get yelled at, we can deal with it. So bus shelter and countdown clocks on West 231st Street at, bus shelter and countdown clocks, West 231st at east side of West 231st Street between Bailey Avenue and Broadway. Actually, it's not Bailey, it's Albany Crescent.
It's good that this came up because that is a follow-up item actually for TNT.
Yeah. Okay.
And you need to change it from DIFTA to DOT.
Yep.
Yeah. Good catch. Yeah.
Okay.
I just have a tidying up thing, just that all this,
Sure.
It's called older adult centers now, not senior centers. So the top.
Is that from last year's? Hold on one second.
Yeah.
Older.
So number 1 and number 2 and just older adults on the heading. Yeah.
Oh. Do we, and I asked, does anybody object if I move up the food insecurity to number 2?
I agree with it, and maybe we can move I'm not sure, but the transportation after affordable housing now? I don't know. Need the centers to chime in if there's a transportation.
Yeah, I mean, transportation transportation for us is a major issue, but the issue isn't funding. It's not money. It's the availability of drivers.
Right.
And I mean,
catalytic
if
converters.
there were drivers out there, I can give them more money so that they can work, but it's the requirements and to drive those vehicles and the availability of drivers.
So does that mean we can move affordable housing and switch these two?
Yeah, you also in the one on transportation, you need to say older adult center transportation.
Yeah.
Yeah. Right. I mean, I have 3 vans and I don't have a driver. So, you know, like it's all the money in the world is great, but there's a whole other issue that needs to be systemically citywide addressed.
All right, so older adult center. Okay.
Julie, is that the same issue at RSS?
Yeah, yes and no. I mean, we have a driver that came back from furlough. We did apply for discretionary dollars to hire a second driver, but that would not be until fiscal 23. So hopefully we may be in the same boat as Sharon, but yes, yeah.
Okay. All right, so any other thoughts on moving the list around or any other topics moving around? So now we have the Older Adult Center funding 1, food programs 2, affordable housing 3, adult center transpo 4, funding for dementia care 5, safe crossings 6, accessorize 7, internet access 8, and bus shelter and countdown clocks number 9 for the east side of West 231st. Does anybody else think that we should make any other changes or modifications to this budget list for expense? Okay, so I'll put it up for a vote. Are there any members opposed to the expense budget requests we have placed forward in this order? Okay, I think are there any abstentions? Would any members like to abstain from this list for expense budget requests? Okay, I think we are unanimous on that. So expense budget requests are done. We don't have any capital budget requests from last year. I'm certainly open to hearing if any members have capital budget requests that they would like to put forward. Okay. Okay, so I guess we can move on. Providers, do you guys have any updates for us?
We're tired, right? So, right,
You're
Sharon?
tired. That works. I
Yeah,
can do
we're
that.
chugging
I
along.
can do it. I can do that. We're tired.
Just, you know, I think we're increasing our capacity. You know, we're balancing serving people remotely, but also encouraging them to come on site. We want to be able to do both. It's a juggling act all the time. I can't say it publicly, but we're going to have some staffing changes that's coming down the pike. That'll be, you know, interesting to maneuver. But we did recently hire a community engagement coordinator. His name is Isael Tejeda, and he works out in the community to help us connect with our other stakeholders. So I will invite him to a future aging committee
Okay, great.
meeting. He just started a couple of months ago, so he's getting his feet wet. So.
Okay, great. Great. Sharon,
Oh, and our
Miriam?
social adult daycare is back in person, limited capacity, but back in person.
Right.
Daycare in person. Okay.
So we're chugging along. We're still feeding 40, we're still delivering meals to 40 people. We're doing about 40 to 50 people a day for on-site lunch, which is about half of what we were doing pre-pandemic. And then we have another 20 people grab and go. We're doing some virtual stuff, not nearly as much as RSS. We're really trying to stay away from not developing more virtual programs and trying to get people to come in. It's going to be a long road to getting people back into older adult centers. They're not, you know, people are scared of the virus, or they've also aged out, and the younger generation, the new beta generation, hasn't had an opportunity to get to know what we do yet. So, and yeah, people just don't want to be in group settings. And so it's going to take a long time to get back to where the capacity and to where we were before the pandemic.
Okay.
Yeah.
Yeah.
I'm
Sharon,
sorry.
can
Oh, sure, Lee, go ahead.
I'm not a senior service provider, but I'm a member of the RSS. And I just want to say one reason why people don't want to come in person is wearing the mask for older persons is, and I'm one of them, very difficult to do activities and breathe, you know, when you want to do exercises and also talk. So that's one reason I think people don't want to do. The other thing is I want to talk about Thursday's Advocacy Day. Julie, you didn't talk about it. Aging Advocacy Day.
I am so sorry. Thank you, Lee. Go ahead.
There were over 200 older adult centers from all over the 5 boroughs there. And there were at least 6 elected officials, including the chair of the aging committee, Crystal Hudson, and as well as our own Eric Dinowitz, who only came because he saw the bus and was wondering what was going on, that we were down at City Hall. Otherwise, he wasn't planning to speak. But in any case, it was primarily organized by Live On New York to make it known to the city council members who had the ability to increase funding for these centers for all the reasons we just talked about. So we're hoping that they heard us, and that when you submit this to the powers that be, then other centers doing the same thing, maybe there will be funding increase for these centers that are doing all this fabulous work.
Yes, Lee, and thank you also. If you go on to the Live On website under advocacy, there's a letter writing campaign. They've also just announced today that there'll be another City Council Aging Committee meeting on the 12th. No public testimony at that, but that's where they're going to be talking about the budget. So I can forward those links to you, Dan,
Okay, that'd be
if you'd
great.
like me to. Yeah.
Yep.
And even if you don't testify, sitting in or listening in, because they're live streamed to the Aging Committee's hearings, very interesting. Because there's also this year, which I think is new, there's a subcommittee on food insecurity for older adults. So again, but Crystal Hudson, I think, is going to be doing a great job as the chair. So thank you, Lee, for reminding me.
Great.
You're welcome.
And Miriam?
I don't see her.
No, she's
Oh,
not.
Miriam, did she leave? Oh, I guess she had to
I
step
didn't-
out. Okay, gotcha. Okay. So we'll move on then at that point. Thank you for the updates, everyone. And the next item is approval of minutes. Let me post them on the share screen. Let me just pull them up. Save this from today. Where are we? Open. March. Okay. I'm sorry, I'm just getting back to share screen. Yes, okay, that's the right one. Okay, can everybody see the minutes right now?
Yes.
Okay, great. So I'll scroll down so folks can see if you need, unless you want me to read through them, I can certainly do that. It's up to you guys. We, from last month, or not last month, but in the month of March, we had a discussion on the racial equities as they pertain to older adults within CB8. I simply listed the items that we had spoken about at that meeting. Food insecurity, number 1, housing subsidies, medical services for older adults, transportation for older adults and cost of transportation, cost of living adjustments for increased wages for human service workers and bilingual workers, folks with long-term COVID, what are the stats, and are people aware of the issue? And then family members can be paid as home health aides. So those were some of the issues that we had raised with regard to racial equity issues. We had our provider updates. And then we had our minutes. It was a pretty pointed meeting. Does anybody have any comments, notes, suggestions, changes, modifications, anything that they would like to do regarding the March 14th minutes? Okay. So any members opposed to approving these minutes? Would any members like to abstain from approving these minutes? Okay, so I think we have a unanimous approval for those who are in attendance. Share. And okay, are there any other items for any other members that they would like to discuss?
We're having a June meeting.
What's that?
Or if we're having a June meeting.
Yes, as of now, I plan on having a June meeting. So unless something comes up, I do intend to have a June meeting. It will be brief. For those who have not heard, I'm not seeking renomination of the Aging Committee position or Chair of Aging Committee next year. So there will be a new Chair of the Aging Committee next year. So my final meeting for the Aging Committee will be in the month of June. So until then, everybody have a wonderful day. Enjoy the weather. It's
Thank
like
you.
70 degrees outside and sunny. So it's a nice break.
Sounds good.
Thank
Have a
you,
great
bye.
day,
How
everybody.
do I get my photo up there? I'm just
Stay
curious.
safe.
I think you need to sign in, Rita. So
But I
on
didn't-
Zoom itself, well, I know what you're saying, signing in. There's a login for the Zoom itself. So like if you go to zoom.com,
Right?
right, you have to sign in to Zoom.
Oh, I don't know. It just started happening about 2 months ago.
You might be logged out.
Yeah.
So if you go to zoom.com right now, and I
Right.
don't know if you can or not, but go to zoom.com and you'll see login. And
Right.
you'll need your credentials to log you in.
Oh,
So
I
that
have
way,
to
when
get
you
that.
launch a meeting from the board office, as long as you're still logged in, and that's the other thing, you put remember me on your computer for zoom.com. So that way it recognizes you. And that way, whenever you come into Zoom, you log in. The other way to do it is just, when on your Zoom app in the beginning, there should be a login screen.
Yeah.
What
Okay,
we all do
thank
is
you.
we go to just so you know, we all go to like the agenda, we hit the button.
Right, I
and it
never
takes us
had a
here.
problem the past 2 months.
I think you're logged out
Oh.
of the Zoom.
Maybe. All right, thank you.
So if you check that out, hopefully it works.
Lovely work, folks. I love hearing what
Take
you
care,
do.
guys.
Okay,
Bye,
bye-bye. Take care.
Myra. All right, guys. Have a good day.
Sorry,
Take
I was
care.
late. I was
Oh,
at,
no
I
worries.
was at Rite Aid getting my,
Ah,
yeah,
Wait.
but it's a production to get, the 8 free kits,
Yep.
test kits when you're on Medicare. And it
Yep.
was like a serious major production. So I didn't actually get back home until like 1:45 when I came onto the meeting. So I
Okay.
meant to be on time, but I wasn't.
Okay.
We're
It's
glad
all
to
good.
see you anyway.
It's all good.
so
It's
may
all
your
good.
test be negative.
doing, Lisa?
Yes,
Yes, well, we
yes.
got 3 chorus people who just tested positive. So
Oof.
the rest of the chorus is freaking out.
Wow.
Yep.
I don't even know if there's going to be a concert.
Hmm.
Oh,
Oh,
gosh.
I know, it's
Good luck.
horrible, but I'll keep you posted. I'll see you tomorrow.
okay.
All right, guys.
Okay, right,
Take
tomorrow.
care.
Okay.
Right. So
Hey, Lisa,
long,
you got 1
everybody.
minute?
Me?
So long, everyone. Yeah, if you hang on for 1 minute.
Actually, yeah, I had a question for you. I was just going to call you.
I'm gonna go.
Okay, bye, Rita.
Bye-bye, take care, be well. Bye.
Okay, hey, so I got your email. Thank you. Good. I'm glad you're signing up for Aging Committee. That's
Yeah.
awesome. So, interviews. I'm gonna find out tonight for interview dates. We had basically put out the 9th tonight and the 19th. The
Right.
19th. So what we did, and I don't know if you'd gotten word about it. What the nominating committee did was decide that we were gonna. Well, let me see if I can just do it without saying be complicated. For any chairs who had tenure and were staying with the same positions, like quite frankly, like a Chuck Murdler, we're
Right.
basically turning to and saying, unless you have a pressing need to come and tell us something, we don't really want to hear from you.
Right.
Um,
Good. Yeah.
Now,
But I
you're,
guess I have
it's
to do it
interesting.
again.
Yeah, that's like the interesting thing. And I'm going to, like, I didn't want to just respond to you before first speaking to the nominating committee.
Yeah.
Obviously, you've been the aging committee chair before, but now you're coming back to it. So now I'll speak to the committee and we'll see what they'll say.
Okay.
So that and I'm going to say it in 2 minutes. We've got the interview schedule locked up for the 19th right now. So we're going to need additional dates.
Oh, so this,
Um,
you know who's interviewing tonight? What position?
Yeah, tonight. Yeah. So we've got a few interviews tonight. We're doing 3 interviews per night, basically. So
Okay.
tonight we've got the 2 candidates for traffic. So it's going to be, it's going to be Kelly first,
Mhm.
and then Camelia is interviewing for ENS, and then we've got Deb interviewing for traffic. So 5:30, 6:30.
Mhm.
And then on the 19th, the other thing that this committee had decided, was suggested, and I thought it was a good idea, were any chairs who came in this year in a special election, we were basically, calling them in
Hmm.
to see, and to ask them to do an interview. So there were actually three. I could only remember one or two at that point, but essentially there were three chairs who had done that.
Okay, well, if you want to squeeze me in sometime, I'm fine.
So tonight we'll discuss it as a committee, and I'll
Okay.
find out what the next dates are as soon as I know the next dates.
Should I tune in tonight or no? That's just personal, yeah.
It's personal, it's up to you. I'm actually gonna make a statement regarding that. I don't know if you remember back in the day, what we used to say is, hey, you're allowed to come, but it's kind of,
Although I told you, I felt like it was like a reality TV show doing it. but-
same.
Yeah,
So I'm gonna make a statement regarding it and just say, listen, by law, you're allowed to come if you want. You could certainly be here, but consider, just ask yourself whether or not if you were doing an interview, you'd want other folks sitting here watching you do the interview.
right. Okay, but let me know. I'm free on the 19th.
Yeah.
Or, I get squeezed.
Yeah, if you want to log in, if you want to stay on, or I'm going to do the first 10 minutes of organizational stuff and then get into the interviews. It'll be very quick, the organizational, and we'll probably come back to the meeting dates at the very end of the meeting.
Okay.
But
I
in
won't
the very
tune in
beginning, I'm just
for
going to do
people's, just
Yeah.
for people's personal, I don't want to make anyone nervous by having lots of talking, lots of heads at the meeting.
I don't think I've ever watched somebody interview in like the years that we've done it, unless I was on the committee. And I was only on the committee 1 year. And other than that, I've only logged in for the organizational stuff.
Right.
I don't know. Not that I would really care, but
Yeah, this is weird.
Yeah.
Okay, let me know if I need to, and
I'll know tonight.
yeah, it's probably good not to say, oh, I'm available tonight also, because in case somebody else steps forward, hey, who knows, so.
No
Good
other notices.
time.
We didn't get any other notices for aging.
Yeah, what about housing? Anyone step up yet, or?
Still blank.
Okay, well,
So
good
we'll
luck.
see if we can fill that role.
Tonight, I know you go right from there to Ellery, so,
All right.
okay, see you, Dan.
Bye, Lisa.
Bye.